board this evening, Marcia. Jeff Hughes, Joyce, Megan, David, Laura, Jeff Townsend, Dan, and me. We're all here. Are you set to begin, Marcia?
All set, Lynn.
Okay, great. Thanks so much. I'm going to call the special meeting of the Woodbridge Board of Education to order then at 6:32 p.m. This is a special meeting of the Board of Education, and therefore there will be no public comment this evening. I would like to remind everyone to kindly mute their microphones to avoid any background noise. So if everyone would just check now to make sure you're muted, that would be great. Thank you so much. The first item on our agenda this evening is the appointment of a new superintendent. So I will give a report from the search committee to begin. At a special meeting on June 22nd, the Woodbridge Board of Education voted to act as a search committee for the new superintendent. The Woodbridge Board of Education hired the search firm of JE Consulting, and the search process included multiple community forums, staff meetings, and a stakeholder survey. The board received 27 applications and interviewed 9 applicants. Throughout this process, one candidate emerged as a fit for the Woodbridge School District. The depth and breadth of Dr. Jonathan Budd's work in the field of education is impressive. He has served as Assistant Superintendent of Schools in Trumbull since 2015. Prior to his appointment in Trumbull, Dr. Budd was an English teacher in Region 9 and in Windsor as well, as an adjunct professor at Quinnipiac University, Trinity College, and Columbia University. Dr. Budd received his teaching certification from Connecticut College, his master's degree from Trinity College, and his superintendent certificate from the University of Connecticut. He is a graduate of the doctoral program from Teachers College, Columbia University. It is my belief that Beecher Road School students will be in the forefront as Jonathan embraces the challenges of leading the Woodbridge School District. As he builds on Beecher's excellence, I am confident that he will bring a dynamic excitement to providing quality learning experiences for students and inspirational leadership for faculty and staff. The search committee is delighted to recommend Dr. Jonathan Budd as the next superintendent of the Woodbridge School District. That being said, I will move that we appoint Dr. Jonathan Budd as superintendent of the Woodbridge School District effective December 14, 2020. Do I have a second?
I'll second.
Jeffrey Townsend seconded. Marcia? I will now take the roll for a vote. Jeff Hughes?
Yes, approved.
Joyce Favors?
Enthusiastically, yes.
Mike Strambler?
Yes.
Megan Genovese?
Yes.
David Ross?
Yes.
Laura Florente Fernandez?
Much excitement, yes.
Jeffrey Townsend?
Yes.
Daniel Cowan?
Yes.
And I will conclude the vote to make it unanimous. And with that vote, unanimous vote, I congratulate and welcome Dr. Jonathan Budd. And I believe that Dr. Budd has joined us this evening, and perhaps he might have a few words to say. Congratulations, Jonathan.
Thank you all very much. It's a true honor to have your support to be the next leader of the Woodbridge Public Schools. As you know, throughout Connecticut, Beecher Road School has a premier reputation for educational excellence that recognizes the unique value of each and every child. And my first and foremost goal is to lead us in continuing to build upon that strong foundation, which means uniting us as a community of students, parents, teachers, administrative and support staff, and board and town leaders. The current pandemic crisis has challenged us and will likely to continue to challenge us in the weeks ahead. But my commitment to you is to listen to each of your voices, to celebrate our successes, and to lead us working together for each and every child of the Woodbridge Public Schools. Thank you very much, and I look forward to getting to know each of you over the upcoming weeks. Thank you.
Dr. Budd, I'd like to say I think you're already a star. I'm noticing 178 participants who are happily here to hear about your appointment.
Very good. Thank you.
And we're happy to welcome you. Stay online. We'd love to have you.
Lynn, can I just mention that not only did we receive many applications for the position, but we received many high quality candidates. And so I think it's just a reflection of who we are as a community to attract such a high caliber of talent. And I think it reflects well on all of us.
Joyce, thank you for that addition, and you're absolutely correct. Okay, moving on. The next item on our agenda is BRS COVID status. This item has been placed on the agenda of a special meeting at the request of 5 board members for the purpose of discussing the school district's response to the current status of the pandemic. For the record and for public information, I would like to share a portion of a communication Superintendent Syriac and the Board of Education received today from Connecticut State Department of Education Commissioner Miguel Cardona and Department of Public Health Commissioner Deidre Gifford, who stated, quote, "The Connecticut State Department of Education and the Department of Public Health are closely monitoring the community spread of COVID-19, as well as the school-related cases of COVID-19. The mitigation strategies we have put in place, masks, distancing, cleaning and hygiene, ventilation, cohorting, etc., are working. We are not seeing sustained person-to-person transmission of COVID-19 in schools or outbreaks of COVID-19 in schools, despite increasing levels of COVID-19 in the community. We also know that in-person learning is benefiting our students' social, emotional, and physical well-being. The Connecticut State Department of Education and the Department of Public Health do not think that arbitrary date-based closures of school are warranted at this time. We will continue to consult with and work with school districts, local health departments, and medical advisors on individual decisions around closures, but are not recommending that districts proactively close for a prolonged period of time in anticipation of changes in disease prevalence. In-person education is too important for our children to disrupt their education further, unless and until local conditions specifically dictate the need to do so." Superintendent Syriac, do you have any information that you'd like to share with the board this evening?
Thank you, Lynn. I do have some opening remarks. First of all, I'd like to welcome Dr. Budd. And second, I'd like to wish all of our veterans a happy Veterans Day. I have invited Karen Wolojewicz to the Director of Health from QVHD to be here this evening. Karen will not be able to join us for the entire evening, but she should be here for around 1/2 hour. So if after my opening remarks you have any questions for Karen, please feel free to ask her. In addition, Ashlyn Fagan, our nurse supervisor, is also available for any questions this evening. As the Board of Education is aware, Beecher Road School has had one case of COVID-19 since reopening to full in-person learning on September 8th, and that occurred this week. Our mitigation factors in place have been successful. We are halfway through our 10th full week of school. Our in-person students attend 5 days a week, not partial week, as in a hybrid model. I am thankful to our dedicated staff, our students, and our parents who have helped us follow protocols to keep our community safe. As I have shared before, as the infection rates began to rise in the community and in the communities around us, we are not seeing in any schools across the state school transmission. Rather, a majority of the transmission is traced back to social gatherings and activities around sports. Every Tuesday morning, the nurse supervisor and I attend a meeting with the Connecticut State Department of Education and the Department of Public Health. This is a meeting set aside for schools where we are provided updates and there is an opportunity for questions. We receive updated metrics every Thursday afternoon. I then follow up with a meeting with QVHD to determine if there should be a shift in the current learning model. When the state began the COVID town alert cycle a few weeks ago, they set up meetings on Thursday afternoons, and we attend those meetings as well, which includes state and DPH representatives. All this information and guidance is utilized in making decisions about whether to change our learning model. We look at metrics, we look at in-school cases, we look at in-school spread, we look at mitigation factors that we have in place, such as masks, shields, hand washing, home screening, cohorting, social distancing, increased use of outdoor space, ventilation, enhanced cleaning protocols, and advice from DPH, QVHD, the Orange Health Department, and CDC guidelines. I am also very cognizant in making decisions of the social, emotional, and physical well-being of our students and how important it is for them to be in school. We have some concerns about the week directly after Thanksgiving, which typically includes travel and increased social gatherings. I shared a plan with the Board of Education, staff, and families last Friday about going all remote the week after Thanksgiving to help mitigate the spread of virus and so as to continue to keep our students and staff safe and not to undo what will be 11 weeks of hard work. The week of all remote learning provides time for individuals who travel to receive test results, and it provides time for symptoms to develop if exposed during a social gathering. Tonight, my recommendation to the Board of Education is that we stay with in-person learning leading up to Thanksgiving. We have 7 days of full in-person learning and 2 days of practice hybrid, and then the Thanksgiving break. The Thanksgiving break will be followed by a full week of all remote learning from November 30th to December 4th. The intention, based on current metrics and mitigation protocols, is to return to full in-person learning on Monday, December 7th. This is not a prolonged closure. By then, we will have updated numbers from tomorrow, 11/12, from 11/19, from 11/26, and from December 3rd to review and determine if changes are necessary to our in-person learning plan. I do have staffing concerns every day, and if the school has additional cases that overlap, I worry about being able to staff the building. One case impacted our school in the area of human resources, and multiple overlapping cases may require a brief move to all remote due to the inability to staff the school. We have felt an impact to our staffing prior to our first case due to staff members who have been directed to quarantine, or staff members who are awaiting test results, or if they're impacted due to childcare because the district where their children attend school has had to close. So as the Board of Education has a discussion this evening around COVID status in Woodbridge, I'm advocating that we stay the course with full in-person learning for the next 7 days and then reassess the data in early December. Thank you.
Thank you, Christine. I know, Karen, I'm really having a hard time with your last name. Wolojewicz? I'm wondering if you have it, and I'm wondering if you have, and I apologize for the struggle with it. I'm wondering if you have any comments that you would like to make at this time.
Sure. I just want to echo Christine's statement that we do want to keep children in school as long as possible, continue to monitor the data trends. So base our decisions, it's data driven always. Like Christine said, the state of Connecticut releases a Thursday report where they release average daily rates of COVID-19 cases, looking at a 4-week period, so that any variables on a daily case rate can be stabilized over the 14-day period. So again, it's the 2 weeks prior every Thursday. So that data is reviewed, and all superintendents review that data and discuss with QVHD if there would be a potential need to change the learning model. So again, I just want to emphasize our decisions are based on data, and we continue to monitor the community level of transmission. And again, these are individual decisions on a school level to see where schools would need to transition to a different learning model based on the data.
Thank you. All right, I think we will, so for those of you in the public, Karen is the, I believe, Quinnipiac Valley Health District Director of Health. Is that your title, Karen?
Yes.
Okay, great. Thank you. So we'll start with our board members' questions and comments. Jeff Hughes, I see you right at the top of my screen, so I'll call on you first.
Karen, thank you very much for joining us this evening. Both you and Christine agree we're headed in the right direction. I appreciate us trying the hybrid and fully remote after Thanksgiving model. I have no other reason to doubt your expertise, and I fully support these decisions.
No questions, Jeff?
No questions.
Okay, thank you. Joyce, I see you right in row two for me. You're next.
Okay, I have 2 questions. The first has to do with the criteria. So we started out at the beginning of the year with guidelines that were issued by the state that, now looking at where we are at with the pandemic, would have put us in the red category. But the guidelines have now been revised, and mitigating efforts are now considered. And so the question that I have is, what are the criteria exactly? Like, I think that it would be very helpful for all of us as a community, teachers, parents, board members, et cetera, to be very clear and transparent about the criteria for moving to a different model. And so I understand that there are factors that are reviewed, data that's reviewed, but what will it take before we say, okay, now it's time to transition to a different model? So that would be my first question. The second question is about where we would go. So let's say at some point we decide that it makes sense to transition to a model. What model would that be? And the reason why I ask that question is there seems to be some concern with the hybrid model for a variety of reasons. And so I would be interested in a discussion tonight around what model we would move to if we were to move to a different model based on what's happening.
So in response to your first question, I'm certainly going to ask Karen to follow up what I'm going to share. When we look at Addendum 4, and that was revised in October, it, however, did not change to red. We're currently in orange. I understand that Woodbridge as a town is red because their basis is for town data, it's 15 cases per 100,000. And for the learning model for schools, when we look at that, it is still orange because that is 10 to less than 25 cases per 100,000. So we still fall within that orange zone, which still favors in-person learning and taking a look at the mitigation factors that are in place, whether they're being effective, whether you need to adjust those, or whether you need to consider shifting to another learning model if it's not currently being effective within your school setting. So that's my response to your first question. But I defer to Karen, who's probably better at numbers with this information than I am.
Sure, I can just tag along on that, Christine. So you were referring to the primary indicator that we look at initially, which is the average daily rate of new cases of COVID-19. So that would drive initially your primary indicator of where we're going within the community transmission. Then the state also identifies secondary indicators. So that would be the percent positivity rate. So the number of positive tests over the number of total tests that are collected in the state of Connecticut for that 14-day average for your town. So that would show you the direction of change. So the secondary indicators are trending upward. So you want to monitor that. In addition, you want to monitor the number of new COVID-19 hospitalizations per 100,000 for the 14-day average. Again, that's going to indicate the speed of change. So how likely is the infection more severe in the community? So if you have number of new cases increasing, the percent positivity rate increasing, and number of new COVID-19 hospitalizations increasing, that shows the speed of change, that likely will help lead you to decide whether or not you want to move into in-person. Also balancing that with knowing that you have your mitigation strategies in place.
Joyce, you're on mute.
Thank you. Should we be looking at the town data or county data or both?
We do monitor both town data specifically and county, and it's also important to know where your other neighboring communities are within the alert level as well, because as Christine mentioned, we are not seeing person-person spread in school settings. We are seeing community level of transmission, sports related, social gatherings, dinner parties. So spending time with your non-household members. So that you need to take into consideration what your neighboring towns look like, because there are regional sports that we're seeing that sports tournaments and clubs are crossing jurisdictions. So it is important to monitor neighboring towns as well.
Joyce, do you have any other questions?
So I didn't respond to Joyce's second question yet.
Okay, sorry.
So the second question in regard to, if we at some point determine a move to a different learning model, again, I believe we have to take a look at what is driving that particular move. And if we were to consider the hybrid model, that would be to lower the building density lower than it currently is. So having approximately 50% of the current student population in the building on any given day. All remote learning is that, as we're aware, all students would be learning remotely. So I think that decision can be made at that particular point in time. I will share with you that feedback that I have received from teachers and from administration and some from parents is that there would be a preference to not move to the hybrid model, but to consider then either staying in full in person when metrics permit us to do so, and or to move to all remote when it does not, as it's a very different learning model than we are accustomed to if we move to hybrid.
Anything else, Joyce? Okay, thank you. Mike Strambler?
Yes. Hello. Welcome, Karen. Thanks for joining us. And thank you, Christine, for that report. So I guess my question is, I think, mostly directed towards Karen. I'm curious as to whether there's any evidence on the effectiveness of moving to a hybrid model in reducing the spread of COVID. So I know there's been some speculation about whether hybrid is actually better in terms of reducing spread than in-person instruction. I think some of that speculation has had to do with the need for folks to find childcare elsewhere, and therefore exposure being increased because of that, because of those reasons. I'm just wondering if any work has been done, if there's any evidence either way on whether on comparing the in-person to the hybrid models on COVID spread.
So I don't know if there's exactly science evidence based on the effectiveness of a hybrid model versus in-person learning. But I will echo what Christine said. The purpose of a hybrid learning is to decrease the volume of the person density within the building. And that effectively does do that by having a smaller percentage of your student population in a building setting to allow for the social distancing. So we know that social distancing is one of our strengths in our mitigation strategy within the 6 feet. So that is really important, because if we were to identify a confirmed COVID case in your school setting, that 6 feet is really important in identifying a close contact. So the close contact that we know is 15 minutes within a 24 cumulative hour period within 6 feet. So in a larger student population, full in person compared to a hybrid, I'm not sure. I'm hoping that Christine can answer that. I'm assuming that all the desks are 6 feet apart as much as possible. Some schools may not be able to maintain that 6 feet distance. So some schools are in the hybrid model to decrease that person density to ensure that that we can reduce any further spread of COVID-19 within the school setting. So we do know that it is effective in reducing the person density population.
Mike, I just want to add one piece, which is the state has begun to release data in regard to the number of cases in schools. And when they share that data, they separate it out by in-person, hybrid, remote. However, I would be hesitant to make any leaps, because right now when you look at that, you'll see a higher number of cases in hybrid models than in full in-person. However, what I have not seen is yet teased out there, although maybe they've updated it, is the fact that currently across the state, there are actually many more schools that are hybrid than in person. So it could be that the number is showing different just because of the number of schools in each model. I'm not sure that they've worked that out yet. Just to echo what Karen said, we do try to do our best to maintain 6 feet social distancing whenever possible in our school.
Yeah, thank you for that addition, and thank you, Karen. Yeah, I agree that I don't think that those data can, that we can make any kind of causal determination based on that. But I was just curious as to whether there was any evidence that would suggest that one model is better than the other. Sounds like the data aren't in on that, or the evidence isn't in on that particular question. Thank you.
Anything else, Mike?
That's it for now.
Okay. Megan?
I think Jeff had a question.
Yeah, if you don't mind, just because I have a question directly following on that, then.
Absolutely. I'm sorry I missed your hand.
That's okay. It's actually sort of almost a little bit more of a comment, just following up exactly on what Karen said and what has been said about the evidentiary basis for the hybrid model, and the reticence within our community and within the teachers, staff, and parents to go to a hybrid model at a rapid pace. In particular, I just want to emphasize that if the purpose, as stated, Karen, if you want to back this up or back off on it, that's fine. But if the purpose is to reduce this, to enable us to have the proper spacing, 6 feet, by using a hybrid model, and we're already able to capably do that for 2 reasons: because we've got a fairly spacious school, fortunately, and because we have a substantial portion of our student population in remote by remote option. That implies that there may particularly not be a benefit for hybrid in our context. So I just want to verify if that is basically your understanding as well. Karen, I guess particularly, but also Christine, if you have comments on it.
I think I want to go back to the benefit of hybrid is really decreasing the person spread. So the smaller student population, you're going to have less students together, less students to possibly spread the virus. And also what is key, I think too, I want to make a note of is that elementary schools have the benefit of cohorting, as opposed to middle schools and high schools where they have large populations and they're not able to cohort their student population as effectively as elementary schools, and potentially may affect whether or not they decide to go into the hybrid model as well. So if you can effectively cohort, that will also help with contact tracing if there was indeed to be identified a confirmed COVID case within a school setting. If you were to be full in person, that contact tracing hopefully would be limited based that you know that it would be a certain number of people within that cohort. So again, cohorting is another mitigation strategy that would assist in reducing the spread of COVID-19 in a school setting.
Thanks. Maybe you want to continue with the regular round, and do come back to me when you can. That's right, man. Oh, you're muted, Lynn.
Thank you, Jeff. Unless you want to continue, and then I'll go back to Megan, who was just next on my list. I don't know what you would prefer.
Okay, I'll continue in that case, I guess. So my other question is, I would just, for the sake of parents who may be concerned about the dramatically increasing rise of cases in our nation, in our state, and in our county, and in our town, some parents may be concerned and may wish to take that remote option, but they should understand the evidentiary basis that you're talking about with regard to these. So I want to drill down, if it's possible, as basically we know that the rate in the community is rising dramatically, and from all evidence, the trend is to this red state. Even if we aren't in red right now, we will be in a week or two without any, there's really no doubt about that. So the question is, essentially, the question is entirely about whether or not there is spread within schools in the case that there is community transmission at very high rates. That's the important question for whether it should be in person or not. And so the really important evidentiary basis for this decision is about whether or not there is spread within schools under these conditions. And so I just wondered what has been stated, Karen and Christine, in both cases has been, we have not seen evidence of transmission within schools. And I just wonder if you could clarify what that evidentiary basis is. And let me just preface your answer by a couple comments. It's, clearly And we know from the science that very few kids actually show symptoms of the disease. So an evidentiary basis that depends on children showing symptoms is not going to be a strong evidentiary basis for knowing whether transmission is going on in schools. So I'm really just asking for some clarity as to what we have not seen transmission on schools means, for the sake of our parents who may want to make decisions about their kids with that knowledge in mind.
Sure. So when the state is saying that there's no evidence of in-school transmission, that means that based on contact tracing, based on case investigations of COVID-19, and also that there are no outbreaks of COVID-19 within school settings. So we look at, when we interview cases and contacts, person-to-person spread. So an individual had spread the virus to another individual within the school setting. We are seeing, like I said, community spread. So it may be a student, but they may have person-to-person spread because they're on the same sports team, or they're close friends and they're within that same family pod and they spend the weekends together. So by no evidence of school transmission is no student-to-student spread, and the only commonality or related factor is that they're students within the same classroom. We are not seeing that. We're seeing cases and contacts based on outside community exposure.
All right. I guess my follow-up to that is just to ask if do you have any sort of percentage data on the basis of that contact tracing that you can share? I mean, so when you say we aren't seeing it, you're saying that I'm sure there's some percentage that are where the contact tracing was unable to find the source, and then some percent, I'm just wondering, we have not seen it as a very broad statement. Is there any more evidentiary basis than we have not seen it?
I don't have the state data on that. I can go and ask them and see if they'll be able to share that. But it is a just generalized broad statement that the state is sharing. Again, I don't have access to the entire state system. And our system, again, is limited to be able to identify for each potential exposure. So I don't know if you'll have a clear picture that we'll be able to tell you, because again, we may not be able to identify where people were infected. So it may give you a small picture at looking at the data, but it's not going to give you a true picture.
Thank you.
Anything else, Jeff?
That's it for now. Thanks.
Thank you. Megan? Any questions or comments?
Hi, good evening. I guess first, I'd like to welcome Dr. Budd to the team. We are looking forward to, although we very much appreciated Christine, we look forward to this next chapter. And also thank you, Christine and Karen, for all of your information this evening. And throughout this, Christine has been doing an amazing job of trying to keep us up to date on all the new information coming out, and it's a lot. So I appreciate that. I think others have asked questions that I was curious about. I've been really not sure about the whole hybrid thing lately. I think I was one of the few that was kind of thinking it was a good idea at one point, and now more information feels like it might not be. Never mind that it might not be the best for teachers and families. But that concern of that the students, when they're not in school, when they're home, if they're in other situations with mixing with other students in different situations, then their cohorting is kind of just not working anymore because they're being exposed to folks in different places. So it would be great. We were looking at those numbers. It's unfortunate that we don't know the denominators to know what percentages actually are happening within hybrid versus in person. But generally, I support your plan, Christine. I think that the majority of our students are in person, and based on parent feedback, family feedback, the numbers that they're still there, they do better in that situation. Personal experience, my son does better in school than the distance model. if we need to go to distance at one point, then we need to, and we will figure it out. And I have confidence that we've been working on that, and it's getting better, and it already is better than it was last spring. But there's that's constantly improving and moving forward. But our children, it's hard to speak to it, and I think I speak for lots of families, that when I saw the difference, and I've said this at other meetings, but when I saw the difference in my son when he was isolated, out of school, versus now in school, in person, the difference is night and day. His emotional well-being it's just different. And I'm speaking for many families when I say that. I've spoken to many parents and whatnot. So anyway, I guess my point is, to wrap it up, I just feel like the majority of students are doing really well in person, if we can keep it as long as possible safely. I appreciate Christine and Karen and everyone's work trying to keep track of these numbers, and Jeff and everyone. This is important conversations that we keep having and keep paying attention to the numbers. But I do want to support that if we can keep our kids in as long as possible, then I think that's the best choice. One more thing, I guess, that Commissioner Cardoza had said something, on November 9th on Where We Live. There's a podcast. It was interesting to listen to if folks have had a chance. But one of the things, many of the stuff we've already talked about tonight was mentioned there, but the state is trying to restrict some areas so that kids can stay in school, and seeing how it negatively impacted our society by kids not being in school, and that is an important piece to all of this. So I just thought that was an interesting thing. Thank you.
Thank you, Megan. David?
Cool. Thanks, Lynn. So I guess I would say the same thing I said at the last meeting, which is a huge thanks to the entire BRS team that's done a remarkable job opening under these circumstances and maintaining what sounds like it's been a really healthy environment for the kids' social emotional learning for those who are in the building. And so that's fantastic. I would echo something that Jeff said a little bit earlier, far more eloquently, but in questioning the safety concerns within the school, it's one thing to say that there weren't cases, but there weren't cases in the state of Connecticut a month and a half ago when we started. The baseline levels were so low, and we're now seeing full exponential growth. So the baseline rate is 10 times as high as what it was then. And so seeing our first case in the school now, it's a different situation. And so I understand that there are many parents who are very happy with having their kids in the school building. And if that's their choice, that's great. I think, as we've talked about in other board meetings, we need to be attending to equity issues with education here, that we have 20% of families, including some who have kids with medical issues or family members with medical issues, who are in remote plans, and we need to ensure that they are having equitable education. And from the survey data, that does not appear to be the case right now. So I think that's a crucial thing to factor in. And the other piece now is it may be that families are comfortable sending their own children into the building in some circumstances, but I'm still very concerned about what this means for our staff and what this means for our teachers. And the reality is that we have some kids in the building who aren't wearing masks. We have young kids who may be incapable of wearing masks, who may be touching their faces, maybe touching doorknobs. The reality is that we are exposing our staff to a potentially lethal virus. And so I'm very concerned about our teachers and their well-being and the well-being of all of the families and of our entire community. And so I'd like to hear from the team how we're thinking about ensuring safety for everybody beyond the proximal needs of the students, which are clearly important, and I support that. And at the same time, I think we have a responsibility to our staff and to our community as well.
Karen or Christine, do you have anything you want to comment on in terms of David's concerns?
I just would like to speak to the mask piece. Our students and our staff have been extremely compliant in wearing masks. The only individuals in our school who do not wear masks is if there is a medical exemption, which is under the governor's, one of his executive orders, that if there is a medical exemption, then that individual, whether it would be a staff or a student member, does not have to wear the mask. In that case, we put in place further mitigation factors. We tried to increase the amount of social distancing. We're thoughtful about where the student might be placed in the classroom in regard, or teacher in regard to the ventilation in that particular classroom. So we do take those things into account. But, you know, I don't know if any of the other administrators want to speak up, but maybe it's not necessary for them to do so. Our students, even our youngest students, our students who have special needs, everyone is wearing a mask, and they are doing extremely well with it. So that's the piece that I would share there.
Jeff, I see your hand raised.
Yeah, thanks
Must
for
be-
me again. I just want to congratulate the administration on what is a very, very good in-person start. I neglected to say that earlier, and also the mitigation measures seem to be going very well at Beecher, which is extraordinarily important. I want to follow up somewhat on David's comment and also mine in the earlier comments. Just in understanding again the thresholds for when we might actually go to an alternate course. It seems to me, so as I've understood it, the evidentiary basis has to do with the contact tracing that is going on. And that is, you know, quite reasonable as long as the contact tracing is identifying the origins and transmissions of all the cases. But what I just want to understand well is if the question is, when would we move to a more restrictive educational environment, whatever that be, hybrid, full remote, or something in between, I don't know. And the answer is when we see transmission ongoing in a school environment. What I want to understand better is essentially what that implies to me, and correct me if this isn't correct, but is that what we're waiting for is for an outbreak to happen in school. Now, that doesn't necessarily mean in Beecher School. Maybe it means in another school, and maybe we're a school that has better mitigation efforts, and so don't need to be worried about that. But that's what I hear as an answer there, because I don't see how else we would have an evidentiary basis that transmission is going on in school other than to have outbreaks in schools. Do I understand that correctly?
Again, I'm going to ask Karen if she's able to address that further, Jeff. But the one piece for me, besides my weekly monitoring of all the data and my conversations with people who have more expertise in this area than I certainly do, is also being cognizant of when we get to that point of being in the red zone and whether our mitigation factors are still being effective. But certainly, I would hope that it's not that we're waiting to see spread within our school or anybody else's school.
Okay, can I just follow up on that for a moment with regard to the red zone? Because it's come up a couple times here that we're in the orange zone, we're not in the red zone. And I will preface this by saying that I'm fully aware that the decision criterion that we would make for our school, and I have no opposition to this, is based on the 2-week rolling window that closes every Thursday that decides on a particular time that we should, you know, make a decision. And that's partly because to avoid sort of stochastic up and downs that happen, so that we make decisions not on a day-to-day basis, but on a more reasonable time scale. But if we're talking about whether or not we're going to go into the red zone, I'm just going to share what comes from the COVID Act Now website, which is using exactly the same data as the Connecticut state is. But it's looking at it differently, and in particular, it's looking at the day-to-day results. Other ones. So I'll just share this very quickly. This is the current state of the epidemic according to daily new cases per 100K population. You can see the thresholds for yellow, orange, and red here at 10 and 25. If you go back to the last 2 weeks as a rolling average, you end up somewhere in this orange territory. That's exactly what this site says. That's exactly what the state site says. If you go to where we are now, you can see what's happening in our community. This is particularly for New Haven County, but if you look within the state, it's quite similar. If you look within the town of Woodbridge, it's quite similar. So what I'm trying to just get across here is there is virtually zero chance that in the next couple of weeks we won't be in that red territory, because what you would have to call on for it not to do that would be for essentially a wall to appear right here where nobody became infected anymore for the 2-week average. It's just extraordinarily unlikely. So that is not to say that we need to do anything different from, say, in person. I'm just trying to emphasize that the criterion that we're talking about right here for deciding to make a change on a short time scale isn't going to be change into the red, or if it is change into the red, we know it's going to happen very, very soon, and we should be preparing very actively for that to happen. If, on the other hand, the criterion is this contact tracing and the finding of spread within schools, then I just want to be aware that that is our criterion and not a change into the red territory. So which is the case is what I want to understand, and how are we going to make our decision making going forward, given the, I mean, I really wish that what I just showed you was not what's happening, but it is what's happening. So unfortunately, I think we're in a position where we need to really be thinking about how rapidly the spread is ongoing in our community, and what decision making we're going to have to make on a very short time scale because of that. So thank you for listening to what I had to say, and I'm looking forward to what you have as a response.
So I think there are two things I just want to clarify. So when the state is saying that there's no in-school person-to-person transmission, that's what supports in-person full learning. The difference with the matrix going into the red alert is those three indicators, the primary and the secondary indicators I spoke about earlier, which is the number of new cases, the percent positivity rate, and then the number of new COVID-19 hospitalizations. So I think there are sort of two different criteria there, but yes, we would definitely look to see if there is ongoing in-school transmission, and potentially maybe that would factor in decision making and inform your decision as to whether you want to go into a more restrictive learning, whether that be hybrid or remote learning.
So I understand that. So I'm just, please correct me if I'm wrong, but I just want it to be clear for everyone. I understand that to say, it's not clear whether if we go into that red territory, whether or not we're going to go into a more restrictive learning environment. What is clear is that we're going to go into a more restrictive learning environment if there is an outbreak in Beecher Road School, and possibly if there are outbreaks ongoing in other schools that make us convinced that in-school transmission happens. But it's not clear to me among those what is the case. So I would love to know if there's any more clarity. And if there isn't, I also understand this is a very difficult decision-making environment, and the clarity just may not exist at the moment. But that is what I would like to know is what the distinction among those three things is.
I think you're going to have to put all those external factors together to inform a decision making, right? We're not going to know what the level of the data trends are going to look like. We can't predict that. We don't have a crystal ball. We do know that it is increasing. We're potentially going to go in the red alert. We don't know if there will be in-school outbreaks. So again, that could factor in. What we do have control over is the mitigation strategies. So continue to have mitigation strategies in place to reduce the spread of COVID. So I would like to shift that towards what we can do versus what we can't control or can't predict. And hopefully that will outweigh some of those cases that would, or outbreaks that would potentially lead us into the red alert.
Okay, thanks.
Laura.
Lynn, I'd like to just follow up for a second.
I'm sorry, David. I apologize.
So Jeff, thank you for the additional thoughts and comments there. And I think it's probably important as a board that we just acknowledge that there are separate questions here. One is what the Quinnipiac Valley Health District is going to decide as broad recommendations. But my understanding is that our school still has the option to make our own choices based on whatever factors we consider unique to our school. So I think there's what Quinnipiac says, and separately what we believe is right for our district. So I think that's an important distinction for us to draw. Christine, I also wanted to come back to the second half of my question. In your response, you noted the issues around masks, and I think it's fantastic that it sounds like they are generally working well. but that still doesn't change the question of what do we say to teachers who are potentially in a room with somebody who's COVID positive, and how we think about that risk and their safety.
So our teachers were informed that they would have, if there was going to be a student without a mask in their classroom, they were informed to teach with a shield and have the student have a shield, that they have their mask. And I understand all the pieces. They were shared about spacing the desk out. They were shared in regards to ventilation. I'm not able to share further than that, David, in regard to the response.
Let me just say that. Sorry, go ahead.
My question isn't about the children who aren't wearing masks. My question is, we know for a fact that the rates are very, very high in the state of Connecticut right now. And there will be more children in the building who are COVID positive. That's not a question. That we know is going to happen. And so wearing the standard cloth mask does not protect them from being infected. Certainly having the kids wearing masks minimizes, it decreases the probability that they'll be spreading, but doesn't eliminate it completely. And so the families have full choice of whether they want to send their children into the school. They can make that choice for themselves. That's a different question for the teachers and for the staff who are there. And so that's what I'm really focused on.
So I absolutely understand what you're saying, and currently it is our expectation that our staff report to work. Our staff who have presented to us, if they have health concerns by their medical provider, we address those as they're presented to us. But I understand what you're saying, that they were not provided the option that our students and families were provided.
Did you have anything you wanted to add to that?
I just want to say that wearing a mask is, again, just one component of your mitigation, your suite of mitigation strategies. So the effectiveness of reducing the spread of COVID-19, it doesn't rest alone on just wearing masks. We all know that. It's the suite of the entire mitigation strategies: social distancing, cohorting, cleaning and disinfection, and ventilation, and hand hygiene. So all of that together will help reduce the spread of COVID-19 and protect your student population and your staff.
Thank you. David, did you have anything else?
No, I mean, I appreciate the thoughtfulness here, and it sounds like what you're saying, Christine, is very least that if there are staff or faculty who have concerns for their own health or well-being, that's something that they can bring to you as a concern, and that you would be able to address with them on a case-by-case basis.
Yes.
All right, thank you.
I just want to jump in for a second and say something. There's a gentleman who has his hand up, and I want to remind everyone that there'll be no public comment tonight. That was said at the beginning of the meeting, and someone who joined late might have missed that at this point.
Thank you, Dan. I was just going to make that same comment, that this is a board discussion this evening, as it's a special meeting. I'll just remind anyone who perhaps signed on later that there is no public comment this evening. It's board discussion. Thanks, Dan, for that. I think Laura.
Lynn, sorry, just
yes.
to follow that up real quick. I just want to follow that up again really quick. On Monday is our board meeting that we do have public comment at. So if anybody is interested in having public comment, the Monday board meeting would be the place for that.
Thank you for adding that, Megan. And that is true. Monday, November 16th is our regular scheduled board meeting, and there is public comment on that agenda. That's correct. Thanks for that, Megan. Laura.
Okay, I want to also echo everyone's sentiments welcoming Dr. Budd. We're very pleased to have you become our next superintendent. And thank you, Christine, for your transparency and hard work and diligence. I know it's a difficult job. COVID is not, we've never experienced it before. And it's a very difficult issue to address. Also, thank you, Karen, for joining us and bringing your expertise. And I want to thank all the teachers, and I want to thank all the administration for a job well done and working together to provide the personal learning. And just please continue to address the needs of the distance learning. I want to see that improve. And I believe the hybrid is in place, or is a plan that was suggested to provide social emotional and learning in person for a couple of days, and then as well as promoting relationships, and then also doing the distance learning. So it does have some benefits. So I think by us, promoting what the plan that Christine suggested is giving us an opportunity to practice the hybrid. And I think I understand what Jeff said, and what everybody's concern is, David's concern is. I have the same concern, but I think we're lucky that that we have the opportunity to continue to work with the in-person and with the distance learning, that we still have that opportunity. So and also I forgot to mention, I want to thank all the staff members, the food people, the custodians, everyone. So thank you all for a job well done, because I can't imagine if I were still working, how difficult, your jobs are. And I just want to thank you for all you do. That's it.
Thank you, Laura. Dan?
Okay. So I made some notes as some people have been speaking tonight, and I'd like to address a couple of the issues directly. There was a comment made at one point about exponential growth and about entering the red zone and about some data from the Act Now website. And I think that a very important thing to take into consideration is that the last time we were in this rate of change for infection rates was in early April and May. And at that time, we had a spread rate of roughly 30 per 100,000, and we had severe COVID illnesses in the 2.7 per 100,000 cases identified rate. Currently, in August, Florida saw a rate of spread at 65 cases per 100,000. And at that time, they saw a peak severe COVID illness at 0.75, so nearly 3.6 times lower the rate of severe COVID illness from the SARS-CoV-2 disease. And I think there's an important delineation between SARS-CoV-2 virus and COVID-19 disease, which is what actually caused the illness. Anyone who's in the 30s to 50s here, knows about HIV and AIDS, and we all know that HIV was a virus that could be spread, and people live their entire life now without developing AIDS while having HIV virus. Very important analogy can be drawn between SARS-CoV-2 and COVID-19, the disease that actually causes harm. So when we talk about children who don't have symptoms, we're actually talking about this same kind of phenomenon where children contract the virus but don't have the disease. And in addition to that, when people do develop the disease, the treatments that we have are far better, 3.6 times better, specifically, as shown by the data on many of the websites. So I think that, as we often say, we're in unprecedented times. We were in unprecedented times in April and May. We saw even different unprecedented times in August, but they were good times comparatively. And I think we're in a new unprecedented time now, where we're going to have high rates of exposure, but we're going to have, hopefully, I pray, even lower rates of illness. So I think that that's a very important thing we need to keep in mind. And I think that again and again, the secondary metrics are derivatives of the infection rate, right? So they are the rate of change in their infection rate. So they're the predictive models. And so that is why that third secondary indicator is severe COVID illness. And it's actually one of the most important ones that we should keep in mind. Finally, I think that parents reached out to me and said, we really need to consider when we make any of these choices, the danger that we are putting children in if we go full remote. And it's a real and present danger that if we go full remote, children will risk food insecurity, they will risk personal harm. Some places, for some children, the reality is their home is not the safest place from COVID or from their caregivers. And that's a truly sad thing. So I think that before we make a rash decision to take away the only refuge a child may have, because I'm going to quote somebody, what we think is the right thing, one of our board members said, I think we should be listening to our town and not what we think is the right thing. I have in my possession 5, 6, 7, 8, 9, 10, 11, 12, 13 letters from parents who all express that they appreciate the school, they appreciate the mitigation measures, they're aware of the risk, and they're still choosing to send their children in person. I would say that when we set the metric of the red zone at 25 back in April, May, that was that unprecedented time again. And I would actually ask the health department to seriously consider raising that bar to the 50, the 60 transmission rate range, because I would hate some people who think they know best to try to use that bar that was set previously to take away 80% of the populations of this town's right to send their children to school. The governor gave parents the right to choose, and I don't think a board of 9 should take that right away. That's my only comment.
Hey, Dan, can I clarify something really quick? Those letters had multiple signatures on it, so the number of people support is probably a little higher.
They could be a little bit higher, but I did count the first letter as 6 signatures. So the 15, maybe it's 17 at the most.
Thank you, Dan. I believe, Karen, you need to.
I'm sorry, I had one final thing to say. We did receive a letter in the past too from our staff, over I think 46 or 60 of them, I can't remember exactly the number, that had signed saying that they too wanted to remain in the school. So not just the townspeople, not just the children, but staff members do also want the in-person learning model.
Thank you, Dan. Karen, I want to thank you for being a part of our meeting tonight and for you sharing your expertise. I know you have to jump off and you're a very busy woman these days. So I will ask if there's any further questions from the board for Karen, and then we'll continue on and let her jump off.
I just want to, can I just say thank you to her for coming today? I really appreciate the effort, especially in an evening like this. We do it all the time as board members, but asking someone like you to come is really a big favor to us.
Thank you so much.
Yes, thank you for that, Jeff, and I echo that and so much appreciate that you are willing to share your expertise and knowledge with us, and we appreciate it immensely. Thank you.
Thank you for having me, and I apologize for having to leave a little bit early, but I do have to attend to a contact tracing effort here. So thank you so much.
Thank you, Karen.
Bye-bye. Good luck.
Thanks. So Dan, I didn't mean to cut you off, but I did know that Karen's time was limited with us. So do you have any further questions?
I have no further questions, but I forgot to welcome Dr. Budd in 2020, best year ever. So.
Thanks, Dan. I want to just, of course, welcome Dr. Budd as well. We're happy to have you on board. And we all look forward to working with you. I also want to echo what's been said by so many in thanking the administration, the faculty, and the staff for all that they've done. And the staff, including the nursing staff and the cafeteria staff, the bus drivers, the custodians, the teacher assistants, everyone who has just pitched in. And so I share the thanks of the entire board for what's being done. I fully support Superintendent Syriac's plan for November for 2 days of hybrid and 5 days of remote learning around the Thanksgiving break, and appreciate her willingness to work with the BOA districts in having that become a reality. And I thank you for that, Christine. I don't have any questions at this time, but I will entertain any board member who has another question or comment that they would like to make prior to our adjournment. Joyce.
Yes, thank you, Lynn. I guess I had two questions. One is just to follow on Dan's statement that staff want to remain in person as well. I mean, it's one thing to echo what David has said for families to have choice, but staff, they don't have choice. So I would be interested in hearing a confirmation that staff also wants to be in the building, because that would be important. The second question I have is, at some point tonight, if we could pivot the conversation at the appropriate time to talk about the model that we would want to move to when we decide that we want to move to that model. I think that there has been enough hesitation that has been expressed by a couple of board members about hybrid that I think it's worth having the conversation as to whether we should go remote or whether we should go hybrid, given that the timeline is going to be very accelerated if we look at the trend line. And as Jeff had pointed out, we're probably a week or two away from being in the red.
I have a comment on that. So I personally fully support going to a full distance model and not a hybrid model. But I feel like we should hold on to the in-person model for as long as possible. As I said, I think that the current 25 that was previously set in April, May is the wrong number. Especially given the fact that we can maintain social distancing in our school. And the only reason to go to hybrid, as was said by our previous guest, that was to increase spacing. So that's not a need for us. And so I think we should hold on to the in-person model for as long as possible. And I would vote in support going full distance under the explicit condition that we had a metric for returning. And I propose a metric of looking at 2 weeks prior to when we leave as a good metric. So if today we decided that we were going to exit the school in a full remote at, let's say, 45 to go full distance, and 2 weeks prior to that we were at 25, then I would ask that our policy be that we return into the school at 25 and falling, because if 25 and rising was sufficiently safe, then 25 and falling should also be sufficiently safe, because we had proven that we could do it before. That prevents any kind of false starts and false returns. We know that we're going to be well into a safe territory. So that's my comment on what model and when.
Can I just mention, I think that all of us on the board, as a matter of principle, we all are in agreement that we want to keep the students in school as long as possible. I think, that shouldn't have to be said, but I just want to be very explicit that we all are in agreement about that. I think the question is, what is the threshold in terms of safety? And that is a more difficult question.
That I can jump in. I agree with that. I think I agree with having a metric for determining when we're going back to school, but I think we don't. What concerns me is that we don't seem to yet have a threshold for determining when we need to do something different from what we're doing right now. This really concerns me. So, based on the conversation we just had and what we just heard, it just seems like that even if we go into red, that doesn't necessarily mean we would go to a different model, whether it's hybrid or whether it's in person. And the emphasis that's placed on school spread was concerning to me as well, because it does seem like there's too much emphasis being placed on waiting for an outbreak within schools. And to me, that seems too late to be making a decision about whether we change our model. So I'm all for talking about, what the new model will be, whether it's hybrid or whether it's remote. But I mean, right now, I'm more immediately concerned about the fact that we don't have a clear threshold.
Mike, I too share those concerns on not having the clear threshold, but more at ease knowing that our superintendent has a direct link to QVHD and CSCE. I think she proved her worth tonight bringing the director of the health district on this meeting. It shows me they're working in lockstep, and I think we take direction from them as they're the experts. That's my opinion.
I hear that. I guess my mind wasn't put at ease by some of the answers that were provided to questions about when we would need to switch to a new model. I don't feel any more clear about that following the comments that were made and the responses that were provided for the questions.
Sure. And my take of it was it's a combination of factors. But to try to pinpoint a single number or a single directive is kind of hard to do at this point in time. I think they look at data daily. I think they look at what's going on daily. They're communicating daily. And I think getting a whole picture of that daily report is what's going to help determine the outcome of which direction we're going.
So I agree. That's the situation, but I like Michael. Obviously, I'm very concerned that the direction that path, they've let I mean, I listened to everything that Karen supplied, and I really appreciate her coming and providing that. And I'm not, it's not her, she's not making this, so I'm not saying anything about her, but I'm just saying the path that's being written out for us is a path where we continue into the red, and maybe a decision is made because we go into red, or maybe not. And then the next path is, well, if we go into red and we don't make a decision to go into a situation of more restricted learning, then clearly the next barrier is seeing school spread. There's not another, you talked about the secondary metrics. Let me just share a secondary metric for you. If I share, and this relates to what Dan was saying, if you look at the ICU headroom used in New Haven County right now, this is the same exponential growth that we're seeing due to cases. We're at 64% capacity here. If we go up in cases more, we're going to fill our capacity. So,
Can you show me other counties other than New Haven?
Excuse me?
Like, do you have a statewide graph? Because New Haven is, unique. New Haven's a unique county given the size of New Haven, the city, inside New Haven, the county. So maybe looking at ICU usage statewide, considering that we have the entire state worth of hospitals to use.
We could look at
Yale New Haven Hospital.
We could look at Massachusetts or maybe New Hampshire. Maybe we could use the capacity in Vermont, Dan. Is that what you're suggesting?
No, I'm saying use the capacity in the state of Connecticut, because I can drive across the state of Connecticut in a half an hour. So I think that ambulance can get there even faster.
Do you think people who come to our community who come down with COVID should drive to the northeast corner for their hospital care for COVID?
I don't think that's the case, Jeff, but I think you're throwing up a start.
You're arguing.
Say again?
I don't understand what you're saying. If you're not saying we need capacity locally, you're saying the capacity somewhere else is going to take care of all the people who are in severe lethal COVID-19 cases.
I know. I'm saying that Yale New Haven Hospital throws New Haven's information off because they're receiving patients from elsewhere. Not that our patients are going to go elsewhere, but patients from outside of New Haven are coming to Yale New Haven because it's a uniquely special hospital. So we're getting false highs in New Haven County. Can you show me people outside of New Haven in that graph that are in Yale New Haven? But I also think we're getting into the weeds because we actually have a much better metric. We have a real-time, market-driven metric.
41%.
Okay, so in the green.
Same potential growth. It's slightly lower than Yale, but that's not a significant difference. As far as we
Can I
need to
mention
be.
one thing, though? Because you said we have no secondary metric other than outbreak. And I would say that we do have one. We have a real in-time market in the school. We have 80% of the population choosing to send their children to school, and 100% of the population has the ability to pull their children out. And if large portions of the people that we're servicing feel that the school is unsafe, then they will pull their children out. So what I actually say to you, and I'm going to give you time to speak right now, I think you should make your best case of why people should take their kids out of school. But then as a Board of Ed, I think we should wait to see what our constituents tell us to do by their actions. And then we should respect their actions.
Dan, all I'm trying to do is to try to make some clarity about what our metric is for deciding to go into our next stage.
Yeah.
If you have another just proposed, I'm very happy to hear it. I'm not trying to make a statement that we need something now. Like everyone else, I would like to maintain in-person learning as long as we can maintain it safely. And my question is, what is our metric for making the next decision? And I don't understand. And if our metric is spread in other schools and not ours, great. I mean, like, then I know what our metric is. But right now, we're in a situation where it's not clear if going into red is going to be a situation, and it's not clear if we're going to wait until there's spread within schools. And that, as far as I can see, that is the point where we would close. Because I know if we had spread in schools, that probably would happen. Close, I mean, move to a more restrictive option. So I'm fine with being clear with the people of our community about what our metric is. That's the purpose of this meeting. So the people of the community can reflect on that, can respond to that, send letters saying they don't like our decision, they like our decision, but let's think forward instead of thinking backward all the time, especially in a situation of a burgeoning pandemic that is growing exponentially and is driving people into the hospitals in droves right now across our state. So I don't want to be looking back saying we made the wrong decision now. I want to be looking forward saying we're clear on what we're going to do. And that's the purpose of all the questions I'm asking, not trying to drive anyone out of the school. I'm just interested in making sure that we have the right metrics in mind for the decisions we're going to make and not be set in a situation where we're driven by a bunch of soft metrics, which is what I've heard from everyone, that mean that we're going to wait until they're spread within the school. I just want to be assured that's not what we're waiting for. And I haven't heard a single word from anyone to assure me that's not the case.
That's exactly my concern as well. It seems like all the communication we've heard, all that leads to us waiting to see whether spread happens within schools. And then when it happens within schools, then we'll change our model. I'm not pushing us in any one direction or the other. I'm not saying that we should close down right now and go remote or hybrid or whatever. All I want is some clarity around the threshold for when we will make a decision.
I would echo that request, which is just for clarity and transparency. And again, not to push the timeline or to say that we should move to a certain model. It's really just about clarity and transparency.
Christine?
So I absolutely hear what the Board of Education is saying, and I certainly do not have the exact answer that you're looking for tonight. And I also heard that you understand that as well. I will share that I do attempt to be extremely clear and transparent, but I do not necessarily have the threshold that you're currently looking for. However, that being said, I've been invited to a new meeting. I believe I shared that with you via an email called the Red Alert Dialogue tomorrow afternoon. And I would encourage the board members, if there's a specific question that you would like me to ask at that meeting in regard to the threshold, if you would email that to me, I'd be more than happy if I'm given the opportunity to ask that question. And if for some reason this meeting doesn't include that opportunity, because I've never been to this particular meeting before, I do know that I would have the opportunity to submit the question in advance of the Tuesday morning meeting, which is with the Department of Public Health for the state, as well as the Connecticut State Department of Education. So I could submit it there. So I would just ask you, I know what you've shared tonight, but if you could put that in a question that you would specifically like me to ask, I would be more than happy to submit that question and get a response for the board.
I nominate Jeff to send you that question. Jeff, are you okay with that?
Yeah, I'll definitely send a question.
Okay.
Thank you.
And Christine, can I go back to the question about the staff? I was just curious, given Dan's comment that the staff wants to be in person. Is that your understanding as well?
So Joyce, I have not done a survey. I haven't done that. I think certainly during the course of our day and are working with the staff, there are staff who are extremely happy to be back in person with the students. They love working with the students every day. They are driven by the fact that they see how happy the students are to be there and how thankful the parents are. That being said, do I think that there are staff members who have anxiety when they arrive at work or when they have to come to work, in particular with the current rise of infection rates? Absolutely. And they could actually be the same people. They could be the people who are extremely happy to be there and in person. And when they're in front of the kids, they forget all that and they just have a wonderful experience as being the caring, heartwarming, dedicated teachers they are. And then they go home and they watch the news and then they struggle to get up the next morning and come back into work. So I have not done a formal survey, but I assure you we probably have both.
And
Laura, thank you so much for clarifying that.
Okay, Laura, you had a question. Dan,
Well,
you'll be next.
No, I'm just saying, aren't we really just buying some time with the hybrid and with the plan and that Christine is proposing? Isn't that buying us some time and we can, at that point, after we come back, we can look at the data and make the decision then? If we continue remote or if we continue in person?
Laura, can you clarify who you're asking? Are you asking me? I'm happy to answer.
Yes, please, yes.
Okay, I just wasn't sure. I think that the plan, I mean, I'm very much in favor of the plan. I have no problems with the plan whatsoever. I don't think anyone here has a problem with the plan. I think our main concern is whether there's a criterion for making a decision other than that plan. That plan has a number of virtues. One is we're heading to a situation where maybe we'll be at a place where we want to make those decisions anyway. Obviously, it provides an opportunity for training of the teachers in the circumstance that we need to have a hybrid or full remote. And then, as Christine so clearly presented, it also presents an opportunity for mitigation of the potentially dangerous post-Thanksgiving spread. So there's an enormous number of different reasons why that particular plan, I think, is a very good plan to have on the books. However, it doesn't substitute for a plan for what frequencies, what sort of metrics we're going to use for deciding to,
But it's buying us time. It's buying us time to make that decision.
Yeah, absolutely. Absolutely.
Yeah,
But there's no reason to wait. I
No.
would argue there's no reason to wait to make a decision about what metrics we're going to use.
Wait.
We just, yeah.
Okay.
Okay, so I'm going to ask Jeff to mute. And then Dan, ask his question because we're getting a lot of feedback. Thanks.
So I just want to respond to Joyce's comment about the staff and say, like, we do have one data point, which was the letter that we did receive. and I also am personally aware of the anxiety that one feels when they go out in the world. As someone who's never stopped working this entire time, my job doesn't allow me to be at home and possibly lecture to students or something of that nature. I have to actually go inside hospitals and be exposed to people that are ill, and travel around the state and other states, and have people yell at me with no mask on in a fan room. And so it is a wonderful experience. So I totally understand the anxiety a teacher would feel. And so I had made a note before to mention that I don't want to minimize the way the teachers feel in any way, shape, or form. And I totally understand the anxiety, but it's something that some of us all have to face, and not everyone is blessed to have the ability to work from home.
I'm not seeing any hands raised. Joyce?
So it sounds as though on the question of threshold that we're going to get hopefully some clarification from the meeting that Christine is going to attend. And so I wonder if there isn't any other further questions or comments on that, we could talk about the model that we would want to move to, should we have to move to a more restrictive learning model.
I think we should take guidance from our superintendent and go from there.
Thank you, Jeff. I would agree with that, along with the guidance that she receives from the State Department of Education and the guidance she receives from the Department of Public Health and Quinnipiac Valley Health District. Any other comments?
Well, I was responding to Christine's comments that the teachers had expressed that they would prefer to go to remote rather than hybrid. So maybe you could talk a bit more about that, the pros and cons of each of the models, how we should be thinking about one versus another. Because I think I think it's just worthwhile having that discussion.
Is that a new agenda item? Isn't COVID status? I think we're ready to dive into what the next model is.
Should we add it to the agenda for the regular meeting? I mean, I
We
think
could-
that a lot of
we
us
could-
have actually expressed what we prefer. Well,
Okay. So Christine, I see that you're ready to make a comment, and then we'll move.
So I would share that I am not prepared to have that conversation this evening because I did not know that that was going to be one of our discussion points. So I apologize that I'm not prepared to share that information. What I was sharing is that, yes, absolutely, our staff, teachers, parents, etc., we have heard feedback that they find that, and from the Board of Education, that they find that the hybrid model is going to be an extremely challenging model. And that is because most of our teachers do not currently teach both in-person and remote students simultaneously. So that's a huge challenge. And as we've heard from many other districts that are engaged in a similar model, it is very challenging. However, a few weeks back, it was stated that we should be prepared to move to a hybrid model, which is why I brought together a group of teachers to work on what would a hybrid model look like if we were to move there. And I feel the 2 days before Thanksgiving provides an excellent opportunity to practice should we ever need to move to a hybrid model. There is nothing indicating that we are imminently moving to a hybrid model or that we're staying in in-person learning or any of those things, because we're looking at the data week by week and trying to make that decision based on what we have each week. So it's really being done in the spirit of being prepared should we need to go there. And if there's more that you would like, I'd be happy to prepare that for a future meeting, but I really am not prepared this evening to go further.
Can I just throw one thought out there? And I appreciate that you want to take some time to think through all the issues. If the transition, which I can understand, would be very challenging for the teachers and the students to move from one model to another. So let's say in-person to hybrid. The question I have is, how long do we think we might be in hybrid? Because if we're not going to be in hybrid all that long, just taking a look at the trend line, we might want to think about just making one transition rather than two transitions that might be doubly painful. Just want to put a thought out there.
And I agree with that, Joyce, that merits us thinking about, and certainly myself. And then after Dr. Budd, those are the types of things we would need to take into consideration, because at any given point, we don't know how long that switch might be, but possibly. So let me go to the example of the staffing shortage. I may be able to tell that that's going to be for a limited period of time based on quarantines and when people would be back, and know that I needed to close for 3 days. And at that point, I may make the decision for those 3 days, we're going to go to all remote for all students. And then we will transition back to full in-person learning. It would not make sense, nor would it help in the staffing model for us to move to hybrid. So I think each time what is happening at that particular point in time would need to be considered in making the decision.
So, Lynn and Christine, given that the pandemic is worsening so quickly, our timeline is actually very short. I wonder if it would be reasonable to to continue the conversation on Monday, because we may find ourselves in a different situation in a few days. And so, just to be prepared, it might behoove us to do some planning.
Yes. So I was just actually ready to ask Christine if perhaps for Monday she could provide the board with some any additional information, definitely information that she receives from this call tomorrow, and any other pertinent information, if she could bring that forward to the board on Monday evening. I think that would be very helpful. I also think that that's pretty much what the board is looking for. If there's anything else that I'm missing, I'm scanning my screen to see if there's any other heads bobbing or hands raised in terms of information that would be requested, or and we will add to our agenda for Monday evening an update.
It sounds like Christine will have had that meeting, and so to the extent that there's an update on the threshold for when we would move to a different model, that would be helpful, to the extent that you have that information by then. I'm sorry, Jeff, were you going to?
I was just going to say what you just said, Joyce, that just to clarify that what the board is asking for is not just a recap of that update, but whatever can be extracted from that update that enables us to better understand and to community what the thresholds for deciding this are. And I'm just going to emphasize once again that my particular concern is there a threshold that is not going to be contact tracing showing evidence of transmission in our school? Like, how will we know that's not where we're headed before we make a decision?
Okay, Mike, I think you might have had your hand raised.
Yeah, they both basically said what I was going to say. That's what I'm interested in getting more information on as well. I would very much appreciate an update following that meeting. I would like us to get more clarity around the threshold. And, you've probably detected some frustration in my voice around this. I am frustrated about that. I mean, we're about 8 months into this, and it's concerning to me that we don't have that threshold yet. But I do want to make clear that the frustration is not directed to Christine. It's not directed towards you. I really appreciate all the work that you've been doing and the administration, and for your clear communication with us. I mean that genuinely, and it's not even directed towards Karen. But I think that I'm hoping that following this meeting, we'll have more clarity around determining a metric where we can actually make a decision. Either way, whichever model we decide to move to, at least we'll know when we need to do that.
Okay, so I think we have a plan for moving forward. I'm not seeing any other hands raised. So I will entertain a motion. Christine, did you have anything you wanted to add? I'm
No,
sorry.
I'm good, and I will absolutely look into the information requested. And if for some reason I'm not able to have that question asked at tomorrow's meeting, then it would be the Tuesday morning meeting, but I will certainly communicate that to you.
Thank you for that. So I will
Dave, go for it. I know you want to adjourn.
make a motion to adjourn. David Ross, move to adjourn. Jeff Hughes is raising his hand to second that motion. Motion to adjourn at 8:13. All in favor?
Aye.
Any opposed? Abstentions. I thank you all for your participation tonight.
Good
I
night,
thank the
everyone.
administration, and for all those who have from the public signed on, thank you for your interest. I hope everyone has a pleasant evening, and we'll see you back on Monday.
Good night. Thank you.
Welcome in, Dr. Bud.
Good night.
Good night.